everyone. Our topic for today is about principles of good teaching and practice. My name is Professor Teresa Salita. We all know that teaching is a deliberate intervention involving the planning and implementation. So it also intended for our learners to have an outcome-based and teaching strategies that promote effective and efficient learning. So as a teacher, we are the role models for the student and facilitate learning and understanding to the learners. Teaching is a sharing of knowledge and experience. We should be competent enough in order for us to give the best teaching style or teaching our knowledge and dedication to serve our students or the other people. We should teach them the right way in order to attain for them, to uplift them whenever they are experiencing challenges in their life. And at the same time, we also give an instructions which is it involves an communications of informations about specific skills. This will serve as their guide in order for them to get a good outcome on how they're going to facilitate those activities and how they're going to develop their skills. In learning, it's also important to have what we call the knowledge, the skills, and the right attitudes that can occur at any times or any place. So in learning, we should be knowledgeable enough in whatever the activities that we're going to do. We should be skillful enough also as well. But the most important thing is on how we're going to respond, what will be our right attitude that we will be going to show or we will develop when it comes when we learn something. Next is we have the patient education. Patient education is the process of assisting the people to learn a health-related behavior. We have the six major categories of effective teaching by Jacobson, 1966. The first one is the professional competence. So in here, how we're going to acquire this competency? We acquire competency by that we continuously learn. We continuously to study. We have what we call the continuous education as well. We undergo different trainings and seminars. These are the things for us to increase our competency when it comes to our profession. Second one is the interpersonal relationship with the student. This is also a good foundation when we establish mutual trust and mutual respect with each other. So this is a very important things that we should establish in order to attain whatever goals that we want to achieve. The third one is the personal characteristic. What will be our unique characteristics that we can impart to our student? Next is our teaching practices. How does our teaching practices, how will the strategies in order for the student or the learners will easily understand our topic to be discussed for them? Next is on how we're going to evaluate. And of course, the ability to the student also is necessary on how you're going to respond. Is there any learnings that happen? Did the student learn the concept? Those are the things that we need to consider in order for us to have that effective teaching. Next is now I am going to discuss what will be a professional competence. So in a professional competence, it shows a genuine interest in patient. We should show to them how that how we're going to help them, our dedication to help them to attain whatever their desired outcome. The second one is on how we're going to create a creative and stimulating wherein they will be able to understand, they will be going to cooperate and coordinate to them. To coordinate with each other when it comes to the healthcare and how you're going to apply your strategies that they will be able to cooperate with the healthcare system that we want, or the healthcare team care plan rather, when it comes to implementations. And we have also demonstrate, of course, the clinical skills with expertise, with confidence, and always aim for an excellence. For the interpersonal relationship with the student, be sensitive also. Be sensitive enough and convey respect. Uh, be accessible and fair. This is a fairness. There should be a fairness between each student. And of course, it permits the learner to express whatever they desire, but it also incorporate with respect with each other and create an atmosphere which is a facilitate for learning. Third one is the personal characteristic, where means you should have that sense of humor, you should have that caring attitude, you should have that self-confidence and cheerfulness and patience with your learners, with a student, in order for them to learn. For the teaching practice, it should consider the teacher's style, the personality of a teachers, a personal interest in the subject, and the variety of teaching strategy. For evaluation, there should be always communication. You're going to provide feedback on time, being fair on the evaluation process, and give tests pertinent to the subject. And we have also the availability of the student. So it gives guidance during stressful clinical for any situation, that you should learn to listen to the concern of your student. There should be also, give appropriate supervisions on the steps. For example, when they perform procedures, you should have time to answer the question and act as a resource person. We have the 7 principles of good teaching practice in undergraduate education. The first, to encourage student-faculty contact. It means that in here, we encourage to be openness when it comes to the communications, because before, sometimes the student opt not to tell to their teachers if they really understand the concepts well or not. Second one is encourage cooperation among students. We should cooperate in order for us to attain our goals, and that is to understand clearly the concept. Third one is encourage an active learning. Give also a feedback and emphasize on the time of task, and respect the diverse talents and the ways of learning, because each of us have unique style in order for us to learn. So we should respect that, and we should be sensitive enough to the needs of our students. These are my references. Much for listening.